Today we will be exploring social determinants of health. Social determinants of health are things that aren't specifically medical, like gender and race and community resources that impact someone's health outcomes. Each of our interns asked a research question related to social determinants of health and then did some investigation. We hope you enjoy this informative video.
Hello, my name is Carter, and today I'll be discussing how a lack of prenatal care impacts birth outcomes in low-income populations. My research question is precisely how does a lack of prenatal care affect birth outcomes, specifically in low-income populations? Prenatal care refers to the medical care a pregnant person receives throughout their pregnancy. For low-income individuals, access to prenatal care can be limited due to financial barriers, lack of insurance, or even proximity to healthcare providers. Studies show that individuals in low-income communities are less likely to receive adequate prenatal care. This leads to higher rates of complications during pregnancy and at birth. For example, a study published in the Journal of Parentology found the lack of prenatal care in low-income populations is associated with increased risks of preterm birth, low birth weight, and infant mortality. Additionally, inadequate prenatal care can also result in untreated health conditions like gestational diabetes or hypertension. This further complicates birth outcomes. In conclusion, the statistics show that lack of prenatal care significantly impacts birth outcomes, especially in low-income populations. This leads to a higher risk of complications like preterm birth and low birth weight. By improving access to prenatal care for low-income individuals, we can reduce these disparities and ensure better birth outcomes for everyone, no matter where you live or no matter how much money you make.
Hi everyone, my name is Siona, and my research question is how do language barriers affect adherence to prescription medication? A language barrier happens when a patient and a healthcare professional don't speak the same language, making it difficult to communicate. Even though there could be interpreters, there's still something called health literacy, which is the ability for a patient to understand and use medical information. If instructions are too complex, unclear, or in a different language, a patient may take the wrong dose or may not even take the medication altogether. A study I found shows just how much language barriers affect medication adherence. Patients with limited English proficiency were less likely to take their medications as prescribed, with adherence rates of 0.901 compared to 0.938 for English-speaking patients. Additionally, only 21% of limited English proficiency patients with chronic illnesses used online refill services, compared to the 53% of English-speaking patients. And most patient portals are actually only in English, making it even harder for them to manage their health. The findings of the study show that language barriers have a direct impact on health outcomes. When patients can't understand their medications or when there's no clear communication, they're at high risk for complications and struggle to take their medications. Making medical information more accessible, whether through translated resources or better communication, could make a huge difference in closing this gap.
Hey, Improved Life LLC. The question that I asked that I want to discuss today is how does socioeconomic status affect obesity rates? Now, we know that humans gain weight by eating excess amounts of food, and that's like one of the key leading factors to obesity. And there's obviously things you can do to avoid being obese, but like what happens when you're in an area where you either have like a low amount of grocery stores or you can't afford produce? Like, for example, if you have fewer grocery stores, where are you supposed to get healthy foods from? Where are you supposed to get like things that aren't 2,000 plus calories to eat on a daily basis? And even if you do have said grocery stores, those things are expensive. Like, you may not have the $20, you may not have the $100 to buy ample amounts of foods for like a week or 3 days to continue cooking with so you can stay healthy. But what you probably do have, especially if you're working, even if you're low income, is $10 for like a Bojangles or McDonald's meal or something like that. And there are a lot of other factors to play into this, but I want to specifically focus on things like ways you should be able to fight off obesity with, but you can't. A gym membership. So if you're already in a low income environment, you're not making a lot of money, you don't have enough money to buy groceries, what money would be able to go into a gym membership? How would you be able to like do anything to lose that said weight that you're gaining from eating this unhealthy food? And that also plays into time. If you're working these long shifts trying to make more money so you can get out of the situation, you wouldn't even have time to go to the gym, much less work out of your own accord. You wouldn't have time to cook a meal even if you did get the produce, but you have time to eat fast food. So,
according to Elena Sandri, a professor in health and medical sciences, educational level is the amount of education that a person has completed, which can include elementary school, high school, college, and beyond. Additionally, she identifies that the adolescence period, which is from 8 to 21, is one of the most important times of a person's life because that is when they're maturing the most and understanding more things about themselves. And thus, that is when they're creating habits that will last lifelong for them. So these habits can include lifestyle habits and even personality habits, small quirks that are relevant to their own life. Thus, Sandry studied and aimed to research how nutritional status and lifestyle can be impacted from this specific period in adolescence and how that can connect to educational value. While there was a slight difference between the results between men and women, the overall theme was present in both genders equally. The first key finding that she found is that people with a higher education generally have a lower BMI, which means that they had a lower weight in their adulthood. They also had a higher nutritional index, which means that they were more conscious about nutritional value and intake and made choices with their food based on that. For example, the difference between getting a salad when you go out to eat or getting something a little more unhealthy. Additionally, they were also they also drank less sugary drinks and smoked less in comparison to their peers. All these qualities were seen within people of higher education, concluding that a higher education can lead to a healthier nutritional lifestyle. Therefore, Sandry identifies that with more nutritional knowledge instilled in children at a younger age throughout their education, their lifestyle will be much healthier in their adulthood.
Hi, I'm Shreya, and I'm going to be talking about how the lack of internet access can affect telemedicine use across rural communities. So, telemedicine allows patients for consulting doctors remotely, which is especially really helpful for patients who live far away from healthcare facilities or patients who just simply can't make it. However, in rural communities, limited internet access can make it really hard and even difficult for patients to attend to. According to the FCC, over 22% of Americans who live in rural communities lack broadband internet access compared to just the 1.5% of people who live in urban communities. This means that even when telemedicine is offered by healthcare facilities, many patients who live in rural communities just simply can't make it and see the doctor online. A study also found that rural patients without internet access had higher rates of emergency room visits because they couldn't have intervention early by using telemedicine. This is because they might not be able to attend follow-up appointments, leading to poor management of chronic diseases like diabetes and heart failure. Even when broadband access is available, the cost is often also too high, averaging about $70 per month just in some rural areas. Lower income households were found that over 50% were more likely to not use telehealth services just because they might not be able to afford it because the internet cost is too high itself. Without reliable internet, rural residents struggle to access telemedicine on a daily basis, leading to worse healthcare outcomes. Addressing this issue right now will be taken by broadband infrastructure increasing and also making internet access available for everybody around the world. Thank you for watching.
Did you know that access to cancer screenings varies significantly depending on a person's income? In some high-income countries, nearly 80% of eligible women receive breast cancer screenings, while in lower-income populations, that number drops dramatically. Income is a key social determinant of health. People with lower income levels often face significant barriers to preventative healthcare, including cancer screenings. These barriers include lack of health insurance, limited access to medical facilities, and the inability to take time off work. In the study, Cancer Screening Recommendations, an international comparison of high-income countries, examined screening guidelines across 21 countries with high per capita healthcare spending. Even among high-income nations, there are major disparities in cancer screening accessibility. While countries with national screening programs see higher participation, individuals in lower income brackets within these countries still struggle to access preventative screenings. For example, breast cancer screening rates vary. 79% of eligible women were invited to screenings in some European nations, but only 49% followed through with screenings, often due to cost, transportation, or work constraints. Colorectal and prostate cancer screenings are even less accessible to lower income individuals, contributing to late-stage diagnosis and worse health outcomes. When people miss cancer screenings due to financial barriers, cancers are detected at later stages, leading to more aggressive treatments and higher mortality rates. Studies showed that countries with universal coverage for screenings have better cancer survival rates because they catch cancer early. How can we improve access? Solutions include expanding insurance coverage, implementing mobile screening units for remote areas, and ensuring paid medical leave for preventative care. Increasing awareness about free or low-cost screening programs can also help close this gap. Preventative screenings save lives, but income should not determine access to them. Addressing these disparities can lead to earlier cancer detection, better treatment outcomes, and ultimately lower mortality rates.
Maternal education plays a critical role in determining childhood immunization rates. Childhood vaccinations are essential for preventing infectious diseases, yet disparities in immunization coverage persist. Research published in BMC Public Health examines data from 31 developing countries and identifies a strong correlation between maternal education and childhood vaccination rates. The study found that children of mothers with higher levels of education were significantly more likely to receive vaccines compared to those whose mothers had little or no formal education. Several factors contribute to this disparity, Educated mothers tend to have greater awareness of immunization schedules and the benefits of vaccines, so they are more likely to engage with healthcare systems, ensuring that their children receive the necessary vaccinations. Furthermore, higher levels of education are associated with improved economic stability, which enhances access to healthcare services. Even a few additional years of schooling for mothers resulted in a measurable increase in childhood immunization rates. The findings of the study highlight the importance of maternal education as a determinant of public health outcomes. Strengthening educational opportunities for women can lead to increased immunization rates, ultimately reducing the prevalence of vaccine-preventable diseases. Policies that promote female education, particularly in low-resource settings, are essential for improving childhood health and fostering long-term societal well-being.
How does access to green spaces impact mental health in urban populations? Imagine stepping outside your home to nothing but busy streets, loud traffic, and towering buildings. Now imagine stepping outside to a park filled with trees, open fields, and fresh air. This difference isn't just about scenery, it directly affects mental health. Studies show that urban residents with easy access to green spaces experience lower rates of anxiety, depression, and stress. A study published in the Lancet Planetary Health found that individuals living near parks had a 31% lower risk of developing mental health disorders. Conversely, lack of green space is linked to higher stress and mental health issues. Research in Environmental Research 2020 found that people in urban areas with limited access to nature reported greater psychological distress and cognitive decline over time. Why does this happen? Number one, stress reduction. Green spaces help lower cortisol, the body's stress hormone. Number two, physical activity. Parks encourage exercise, which improves mood and reduces anxiety. And number three, social connection. Green spaces foster community engagement, decreasing loneliness. In conclusion, cities need to prioritize green spaces, not just for aesthetics, but for mental health. Increasing access to parks and nature could be a cost-effective strategy to improve psychological well-being in urban populations. So next time you feel overwhelmed, try stepping into a park. Even a short walk can make a big difference.
My name is Laksha, and my topic is air pollution. Air pollution is the presence of harmful chemicals and substances in the air. The air can be contaminated with harmful gases such as carbon monoxide, sulfur dioxide, and other common pollutants. Sources of air pollution are wildfires, volcanic activity, cars, and many more things. It is understandable that air pollution is linked to health problems like respiratory and cardiovascular diseases as per the harmful substances in the air and how humans breathe in these substances every single day. But how does air pollution increase the risk of developing depression in adult populations? According to the article, Growing Evidence for the Impact of Air Pollution on Depression, air pollution increases the risk of depression in adults as it induces inflammation and oxidative stress in the brain. Additionally, it also increases the rate of depression by 2 times higher for each 10 microgram cubic meter increase in the nitric oxide level. As per every increase in the pollutant level outside, it is evident that there is an increase in mental health effects on adults, specifically targeting depression. Depression cannot be a factor that should be ignored, as depression is the 10th leading cause of disability-adjusted life years. Many adults already face depression due to issues with life and circumstances, but the factor of the environment increasing the risk of depression is truly affecting. It is important to consider the determinants of air pollution on adults and make a change. Thank you.
Hi, my name is Isha Prem, and my social determinant of health topic is economic stability. I'm addressing how unaffordable housing rates relate to negative mental health effects in families. So there are 4 broad topics that I'm going to focus on related to this broader topic. The first one is related to financial stress. The financial stress from unaffordable housing causes stress related to managing the costs of meeting other basic needs such as food, healthcare, and transportation. Unaffordable housing can also lead to debt accumulation, as many households rely on loans and are paycheck to paycheck to afford housing. The second topic is related to evictions. The instability related to frequent moves can impact children in the household as well as related to their education and social connections. The third topic is poor living conditions. So due to not being able to locate suitable living conditions for a family, they might have to settle for overcrowding and poor living conditions. These living conditions can have negative impacts to health and physical health conditions, as lack of personal space can lead to conflicts and poor living conditions such as improper cooling and heating, and that can in turn lead to physical health problems. The fourth topic is tied to the other topics, the overall impact on children and families. The children can experience stress due to these household conditions, which can affect their cognitive development, academic performance, and well-being. They're also more likely to develop behavioral problems such as anxiety and depression. This can be tied with parental challenges in which the parents are not able to provide the sufficient emotional support to their children due to their high stress levels. Overall, unaffordable housing can cause economic instability, which can in turn impact both mental and physical health. This is particularly harmful in families where the unstable housing combines with managing daily lifestyle challenges, in turn can lead to negative mental health effects in the family and for the children.
So for my research question, I asked about how climate change affects the general health of people. What exactly is climate change? Climate change is the long-term alterations of the Earth's climate and weather patterns. This is occurring very fast at a very alarming rate and is due to the increase in fossil fuel burns as well as gas usage. The butterfly effects of global warming or climate change. Scientists have observed that there have been significantly warmer air temperatures, melting of glaciers and sea ice, and increases in ocean temperatures and higher sea levels. But how exactly does this provide itself as a social determinant of health? What is it exactly? It is a non-medical factor that influences the health and quality of life. Over the years, there have been over 5 million deaths linked with extreme temperatures rising as a result of climate change. Additionally, an increase in wildfires that cause production of air pollution associated with respiratory issues. Additionally, natural disasters is also another leading cause for destruction and displacement. Damage to infrastructure may lead to human casualties, and even after disaster, residential homes may become inhabitable. This can affect health and the general healthcare system because of damage to infrastructures in various clinics and hospitals. Additionally, it can halt certain providers and workers from getting from point A to point B, limiting the amount of care. Additionally, the amount of resources can be negatively impacted. Additionally, this can also affect lower income communities due to the lack of resources. Economically disadvantaged areas are prone to the health impacts of climate change, like with no accessibility to healthcare and its resources.
Hello, my name is Marlene, and my question was, how do socioeconomic status and education collectively influence health disparities among different populations? And disparities are basically differences or inequalities between groups, often in terms of access, outcomes, or opportunities. In this context, it's about healthcare. So health disparities are preventable differences in health status, healthcare access, and health outcomes among different populations. So the main reason this happens with socioeconomic status is individuals with like a lower status often experience higher rates of chronic diseases, mental health issues, and shorter life expectancy due to limited resources for healthcare, nutritious food, and safe living conditions. All of this adds up and causes more stress too. Financial constraints may lead to delayed medical care, increasing the risk of preventable diseases like the flu, which people who with easy access to healthcare can overcome. These diseases can be way more severe for people who do not have access to healthcare like that. And education. So with education, how this plays into this is higher education levels are linked to better health outcomes, as they often lead to higher paying jobs, increased health literacy, and greater awareness of disease prevention strategies. So people with a lower education may not fully understand how to gain access to healthcare or how they can seek help. So leading to poorer health choices and increased risk of illness. All of this comes down to how they are brought up, their environment, and these factors interact, creating disparities where marginalized populations face compounded health risks. Addressing these issues requires policies that improve economic opportunities, enhance education, and expand healthcare access to ensure equitable health outcomes for all. Thank you.
Hi, my name is Neha, and today I'll be talking about how housing instability significantly affects medication adherence in patients with chronic illnesses. Housing instability, whether frequent moves, eviction risk, or homelessness, disrupts daily routines, healthcare access, and the ability to store and manage medications properly. A study in the JAMA Internal Medicine found that people experiencing housing instability were over 50% more likely to miss doses or stop taking medications entirely compared to those with stable housing. Many patients face logistical challenges, such as losing prescriptions during frequent relocations or struggling to access a consistent pharmacy. Others must make difficult financial choices, like prioritizing food and shelter over medication refills, while some conditions, such as diabetes, require refrigeration for medications like insulin, which may not be available in unstable living conditions. The consequences of non-adherence can be severe. For patients with HIV, missing doses can often lead to viral resistance, making treatment less effective, while diabetics who skip insulin doses face life-threatening complications like ketoacidosis. The issue is not just about affordability, but about the stability necessary for consistent healthcare management. Addressing this problem requires an integrated approach. combining medical care with social support systems. Programs like Housing First, which provide stable housing before requiring treatment compliance, have shown a 40% improvement in medication adherence among participants, which leads to a better long-term health outcomes. Healthcare isn't just about writing prescriptions. It's about ensuring individuals have necessary stability and resources to follow through their treatment, ultimately reducing hospitalizations and improving overall public health. Recognizing housing as fundamental detriment of health is crucial for creating policies that prioritize both medical and social interventions. Thank you.
How does gender affect the effectiveness of heart attack treatments? Cardiovascular disease remains the main cause of death in the United States for both women and men, but research states that women are less likely to receive timely care for heart attacks. They have delays in both diagnosis and treatment. This is due to men's typical symptom and also the most common symptom of a heart attack to be known as chest pain, while actually women report nausea, fatigue, and shortness of breath as their most common symptom. This leads to misdiagnosis and or dismissal. Women remain underrepresented in clinical cardiovascular trials, making it difficult to fully understand the sex differences in medical intervention. Moreover, the patients themselves lack awareness due to the lack of education on women heart attack symptoms compared to men. And in the general public, we don't have a lot of information about how it is different for each gender. The consequences of delayed treatment are that women experience an adverse outcome that includes a higher mortality rate and a reoccurring of cardiac events. When it comes to cardiovascular disease, time is especially of the essence. Strategies to improve this disparity is to enhance education of both the medical personnel and the general public. We can also start campaigns online or in person to promote more medical attention for women. Take research initiatives to promote students to focus on more cardiovascular disease specifically for women to make sure we have evidence-based information. And finally, policies. We need to implement equal healthcare access and treatment for all gender. This addressing doesn't only have to apply to cardiovascular disease. The modern medical technique and skills are mostly developed based on the male gender. We need to expand our horizon now and make the future of medicine equal for every gender.